Hi, and welcome to CVTV. Today we're going to learn all about high blood pressure and what that means. So, Dr. Osborne, when we think of blood pressure, what is that? What does blood pressure mean?
So, blood pressure is a good thing. Blood pressure is a measurement of the pressure of the blood against the walls of the blood vessel, and there is a normal range that we should operate as far as blood pressure goes.
So, blood pressure is what's pushing the blood through the body.
That's
it's
correct.
The pressure behind pushing the blood. And blood pressure comes from where?
So blood pressure really is a function of a couple of things. One is our heart and how much blood it pumps into the circulation. That is how many cc's or how much volume it pumps into the circulation. It's also a function of heart rate, and it's also a function of the constriction of the blood vessels. So when the blood vessels are nice and relaxed, the blood pressure is low. When the blood vessels are very tightly constricted, the blood pressure is high. And it's a function of all those three things, all interacting at once.
I know you got your PhD in vascular biology, so you're a real expert at this. When I went into medical school, I thought what happened is the heart pumped, and you had these static tubes, and the heart pumped, and so the top numbers when the heart pumped down all the way, and the bottom numbers when the heart relaxed all the way. Right?
That's correct.
When you think about the heart pumping and the blood vessels, are the blood vessels all the way opened or all the way closed at a given moment in time?
Well, there's something called tone. So there's always tone. There's always a degree of constriction of the blood vessels, and they're about halfway open, if you will.
So what happens if all of a sudden they open?
So if they open completely and rapidly, that can make you pass out.
Pass out. So fainting is when the blood vessels open up?
Mm-hmm. That's correct.
And so that happens. Sometimes people get emotionally upset or something comes up and their blood vessels open, and then nature has a way to get your head below your feet, doesn't it?
Absolutely. You suddenly go from vertical to horizontal very quickly.
So how do we measure the blood pressure inside a person's body?
The easiest classical way is using a cuff, where we basically exert a pressure on the upper arm. And actually how we do it is that pressure exerted upon the upper arm, we exerted up pressure to collapse the blood vessel. And when we do that, that defines the top number, the systolic blood pressure. We then let the pressure out, and when the vessel completely comes back, then that defines the bottom number of the blood pressure, the diastolic blood pressure.
So what's an ideal blood pressure?
Normal blood pressure is less than 120 on the top and less than 80 on the bottom.
And what's happening inside a person's body as the pressure starts to move up?
As the pressure goes up, the vessels begin to constrict. Sometimes our body produces extra hormones, particularly at the level of the kidney and the adrenal glands, that cause our volume of blood to go up. And that, of course, the more volume there is in the blood vessels, the higher the pressure. Sometimes the heart rate goes up. Sometimes our heart beats harder and faster. All of those things can contribute to elevated blood pressure.
And why is that bad? What is the damage that occurs that make us want to treat that process?
When people have high blood pressure, the main targets, the main organs that it affects are the brain causing strokes, the eyes causing blindness, the heart causing heart failure, and the kidneys causing kidney failure. And also high blood pressure contributes both to the progression of plaque in the blood vessels and also facilitates the rupture of blood vessels and the rupture of these plaques, which ultimately causes the plaques that form in the neck, which causes strokes, the plaques that form in the heart, to rupture and suddenly go to having a heart attack or a stroke.
Wow. So if you keep the blood pressure down, do you somehow slow or keep that from happening?
No question. In fact, we know that people with normal blood pressure, and this is defined in people with blood pressures about 115/75, that every time we go up from 115, 20 points at the top, so as we go from 115 to 135, or 10 points at the bottom from 75 to 85, that just that little jump there has now doubled your risk of a fatal stroke or a fatal heart attack.
You actually have a pretty neat graphic of this, so perhaps you'd be willing to walk us through the graphic and share with us what it's showing.
So this is a very useful tool. We call this the blood pressure map, because maps tell us where we're at and where we want to be. And that's really what this does. And this really explains in a very simple way, but a very effective way, but also a very truthful and comprehensive way, what blood pressure means, where it should be, or as I tell people, Once we're done with this, we'll know when we measure the blood pressure, whether we do it at home, whether it's done in a doctor's office, are we good, are we bad, are we ugly?
So what are the numbers?
So if we look, I always start with what is the definition of high? High blood pressure is when the top number is higher than 140 or the bottom number is higher than 90. That is high blood pressure. And so what happens is with high blood pressure, again, the higher that number, either one of those numbers, the higher the risk. Again, high blood pressure is greater than 140 in the top or less than 90 in the bottom. But if you look at normal, normal is less than 120 over 80. And you go, wait a minute, normal is less than 120 over 80, high is 140 over 90. Well, what about that zone in the middle? Even that zone in the middle, we used to call it high normal. We don't call it high normal anymore. We now call it pre-hypertension because it's not normal. Because even those people with high normal blood pressure have twice the risk of a fatal stroke or heart attack versus someone with normal blood pressure.
Fascinating.
And again, every time we go up 20 points in the top or 10 points in the bottom, our risk of a stroke or heart attack has doubled. So that by the time we're up to 175 on the top or 105 on the bottom versus someone with normal blood pressure, we have an 800% greater risk of a fatal stroke or heart attack.
Wow, that's really scary. But I want to talk from the perspective of a person, like a patient. I'm a family doctor, you're a cardiologist. People come into our office and they sit down, they stick their arm out, and suddenly the nurse looks at them and goes, wow, has your blood pressure been high before? And so now I'm that person. So I'm going to play the role of the person who's just been told they've got high blood pressure. And I want to know from you, doctor, should I be concerned? Does my blood pressure go up and down? The blood pressure in the office here, is that what it is all the time?
What I would have you do, if we're concerned about high blood pressure, is I would, first of all, do a simple experiment. Let's get you a blood pressure cuff. We're going to have you check that at home. In fact, I tell people to do it in a very precise but simple way. I'm going to have you check it at home with a blood pressure cuff, not the wrist monitors, but with a blood pressure cuff. I want you to do it in the morning when you wake up, and I want you to keep a log. I have people check it in the morning because that is the highest blood pressure of the day. And in fact, we know that disproportionately most strokes and heart attacks occur in the morning when our blood pressure spikes. And that's why I want to sample in the morning.
So I'm the patient. You're saying, Scott, go take your blood pressure, get a cuff, and you're empowering me to start to look at the numbers. So I take my cuff and I go down and I keep my journal, and what I find is in the morning my blood pressure is 145 over 92. And so, Dr. Osborne, I'm back in here today. Here's my table. In the morning it's 142 over 92, and in the evening it's 138 over 90. Do I really need to be on medicines?
If we've done that in the setting of watching our salt, trying to lose weight, exercising, those are very effective, simple, non-pharmacologic ways to treat and lower blood pressure. If we've done all those things, then frankly, we need to lower that blood pressure.
So let's talk about salt for a minute. What kind of salt makes my blood pressure go up?
When we talk about salt, what we're talking about is sodium, okay, or sodium chloride. But there is sodium and different kinds of sodium in many, many different kinds of foods and things that we consume. But it's the sodium that significantly contributes to high blood pressure.
And so when I look at the food label and it says sodium and there's a number next to it, if I were to go through the day and try to figure out what we need to keep that number less than, what would I be looking for?
The number that I would tell people would be about 2,000 milligrams or less would be ideal. Now, the fascinating thing is, how much sodium do we actually need per day, metabolically, physiologically? 220 milligrams a day.
So for my body to function normally, I need 200 milligrams, and you're giving me all the way up to 2,000 every day?
Well, I'm going to give you permission to, or I'm going to tell you, I want you to keep it less than 2,000, which is still about tenfold more than we need.
Wow.
So how much do we actually get, the average American get in our diet?
Yeah, exactly. So what is the average amount?
6,000 milligrams a day.
Goodness gracious. Well,
which is 30-fold greater than what we need. And then people say, yeah, but I don't add salt. The salt that is added to our food, that we add, consciously add, is about 11% of that total 6,000 per day.
So 90% of the salt we get, we don't even add ourselves?
Completely unaware of it.
So
it's already in the food we eat.
What food should we try to avoid? I mean, most of the foods that I eat don't taste salty.
We are so used to such a very, very high salt diet that we're completely unaware of it. Anything that you don't make yourself, processed foods, foods out of a can, anytime we go to a restaurant, you're pretty much guaranteed to be consuming a very high salt diet.
Okay, so that's number one. Number two, is exercise. How does exercise help my blood pressure come down? I actually understand, I know as a family doctor, but I'm being the patient right now, I understand that the blood pressure goes up when I exercise. How can that be good?
Well, when we exercise, blood pressure should go up because our muscles need more blood flow, more oxygen, and that's appropriate. It should go up within boundaries. But if you ever exercise and then measure blood pressure after exercise, you'll see it's usually lower after we exercise than it was before. Because what happens is that causes those blood vessels to relax, and that's putting them through their paces, and that's a good thing. If we continue to exercise, our blood vessels continue to become used to relaxing, and that helps to lower blood pressure. When we don't exercise, those vessels always are maintaining a high tone, which contributes to high blood pressure.
So it's almost like lifting weights. The wall of a blood vessel has a muscle in it. That's what allows it to get smaller and bigger, right? Mm-hmm. So and it's almost like exercising is making that stronger by helping it exercise more and more. Mm-hmm. Okay, what was the third thing you said? Salt, exercise, and?
Losing weight.
Weight.
Weight plays a huge role. I see so many people who, they say, well, gosh, I didn't have high blood pressure a year ago, 2 years ago. And I said, well, has your life changed? Have you been exercising more or less? Have you gained weight? And they'll say, well, I put on 20 pounds. So
I always used to hear that for every pound of fat you have, your heart has to push the blood another mile. Mm-hmm. And so if a person, the average American is 25 or 30 pounds overweight, if we took 30 pounds, every heartbeat, that's 30 miles. And how many heartbeats a minute for the average person?
It's a range between 60 to 100, or roughly for the typical American, about 100,000 beats per day, 100,000 times.
So 100,000 beats, and then if you take that at times 30 miles more, that's 3 million more miles the heart has to push the blood if you gain that weight.
It's a lot of work.
It's a lot of work on your heart, and it also, I guess, is a lot of work on your blood vessels. Huh?
No question.
Wow. So salt, weight, and exercise. Okay, so let's say I'm back to the patient again, and I'm saying, Dr. Osborne, I have been watching my salt, I have been exercising, I have lost 4 or 5 pounds since I saw you last, but my blood pressure is still 142/92. Now, if 140/90 is okay, and this is 142/92, it seems awful close. Do I really need to take medications? I hate medicines.
Well, again, that's why I get out the blood pressure map. And what I do on that blood pressure map is there's 4 columns. There's A, B, C, and D. A is 115/75, and then they go up to 175/105. And what I do is I ask patients, because frankly, the burden of high blood pressure is not on me. The burden is on that patient. And I'm educating so that they understand what this means. So what happens is I label those columns and I say, which column do you want to live under? The column where you're at minimal risk, the column where you're 2-fold greater risk of fatal strokes or heart attacks, 4-fold greater risk of fatal strokes or heart attacks, or 8-fold greater.
I got it. So I'm ready to take my medicine now. Thank you very much. All right, so let's just finish up here by having you share with me a story of a patient that and how blood pressure affected her life.
Let me give you 2 examples. In fact, I saw a woman yesterday who had high blood pressure and was doing okay. She was on some medications. She was doing fine. And as it turns out, her blood pressure started to go up. She wasn't aware of this. And what happened is she actually bled into her head. She burst a blood vessel into her head. Now, typically when that occurs, the vast majority of the time it's fatal. Okay, you're usually dead before you hit the ground. That's how bad it is. And if it does not kill you, which is about 80 to 90% of the time, usually the remaining number of people are horribly disabled.
So 10 or 20%
in nursing homes, can't speak, can't talk, can't move their body. Well, she was extremely fortunate. Now, her blood pressure, when this occurred, was 260/140.
Goodness gracious.
Okay?
Very high.
And she literally burst a blood vessel in her head. Now, the beautiful thing is, I saw her yesterday. She's walking, she's talking, you'd never know it. She completely recovered. Her blood pressure is now 110/60.
Wow. And she has to take 3 or 4 medicines to do that?
Yeah, she's on some medications, but it beats the alternative.
Right.
And there's a wonderful example of someone that just about paid the price of hypertension, of high blood pressure, and yet we're able to take care of her, correct it, and she'll have a very normal, long, healthy life.
It's funny to me because you think that she would feel bad. Does high blood pressure not
The most typical symptom of high blood pressure is nothing at all.
Okay, so you can't tell if you've got high blood pressure or not until you actually take your blood pressure.
Absolutely.
Okay. You had a second patient you were going to share with us.
The second patient is unfortunately more tragic. 52-year-old gentleman, had high blood pressure, was on several medications because that's what it took in order to control it, and decided one day he just didn't want to take medications anymore. And so he stopped all his medications. Well, I was on call that weekend, and I get a call from the emergency room saying this gentleman had shown up, and he died. His blood pressure spiked up, and he bled into his head, and that was it. All but for control of his blood pressure.
So
completely preventable.
So the last thing I just want to touch on before we shut down today is you've talked about stroking out in 2 patients now, but is that the most common consequence of high blood pressure that we see in patients as they age if they have high blood pressure that wasn't controlled well?
Stroke and high blood pressure are intimately related. Whenever I see someone who's had a stroke, the first question I ask about is issues related to high blood pressure. The other thing, though, is kidney failure. If you ever go to a dialysis clinic, people on dialysis, you'll see all those patients have high blood pressure. And that's one of the reasons that they ended up requiring dialysis, because that high blood pressure attacks the kidney, destroys the kidneys, and then you're left with kidneys that don't work, and you have to be on dialysis, which is very tough.
The pumping of the heart, the beating on the inside of that kidney, which is I guess a relatively tender organ, eventually leads it to scar down and die or quit working well?
And then, of course, the other thing is blindness. I've seen a lot of people who've had significant vision loss because of high blood pressure, uncontrolled high blood pressure. And then, of course, the heart, causing heart failure. Again, the heart is a pump. The work it does is blood pressure work. The higher that blood pressure, the harder that pump has to work. And the heart will work, but over a period of time, beating 100,000 times a day, when the blood pressure is high, it finally gets to the point where it goes, I'm tired, I'm beat, I just can't do it anymore. And then it begins to enlarge and dilate, and people go into heart failure.
So you're telling me that all these bad things that we've talked about today, we could have prevented just by keeping the number on the blood pressure cuff to what?
Ideally, normal blood pressure, remember, is less than 120 over 80. And that's where I tell my patients I'd like to see them, frankly.
And we have the technology to do that now.
It's simple, it's easy, we can measure it, we can detect it, we can treat it. There's no reason why we should have the excess rates of strokes, heart attacks, heart failure, dialysis that we see if we only took care of and treated blood pressure as well as we can.
Thank you so much, Dr. Osborne, for sharing that with us today.
My pleasure. Thank you, Scott.
And thank you all for being here on CVTV.